Well, hi everyone. I'm Daniel Williams, Senior Editor at MGMA, and we are back with another Mindful Medicine podcast. It's been a minute since we've had one of these, and we're so glad to welcome another one. And today we're joined by Dr. Anjali Rajpal, a leading cosmetic dentist and founder of Beverly Hills Dental Arts. Dr. Rajpal, we are so glad you're here. Welcome.
Thank you.
All right. Now, we're going to talk about a lot of topics today, but I always like to start out with a guest to just learn more about your healthcare journey. When did you know you wanted to be in the healthcare field and then actually specialize in dentistry as well?
Well, I was the daughter of a doctor, so naturally I was following that course. I was skipping lines in waiting rooms because my dad was a doctor, so I had all the benefits of being a daughter. But I was exposed to medicine since birth, pretty much. And my sister ended up becoming a doctor as well. So I was following her footsteps in addition to that, where I was taking all the pre-medical coursework. And in the middle of college, halfway through, after taking care of all the crazy hard courses, I realized that I really wanted to also do art because I've always had a passion for art and have always been making art. And my mom was a really good painter. My dad, so she was amazing with her hands. My dad was a surgeon, so he was great with his hands too. So I think I just naturally had that genetically, that inclination to use my hands. So, so yeah, I decided in the middle of college to go towards dentistry, and it ended up being a perfect fit for me because it's like arts and crafts of teeth. So I'm constantly making things, and it's just such a natural fit for me. So yeah, and then I went to dental school at Tufts in Boston, and then matched for residency at Cedars-Sinai, which is right here, pretty much in Beverly Hills. So that led me to Beverly Hills. I've always been practicing here, and now I officially have my own practice.
Yeah, that is wonderful. So we're going to talk a lot about healthcare, but you caught my attention with the art. So where did you gravitate to? What's your form of art? Where do you like to create?
I mean, I love to paint. During the lockdown, I was painting a lot because we had nothing else to do. Although at the same time, I was completely swamped because it was also the time that I decided to open my own practice. So I was doing all the paperwork for that. It was actually the most crazy busy time for me. I didn't get to watch Netflix like everybody else, but I really got into painting a lot more then because I had the time for it and no distractions. So that's kind of an outlet for me. I love making everything. I mean, I've done sculpture, I've taken glass blowing classes, I've taken ceramics classes. I'm not the best at using a sewing machine, but I am good at sewing by hand and making like boats and just different things out of fabric. So pretty much anything that seems interesting. I play sitar, which is using my hands a lot, and other instruments too. So just anything that's like an artistic outlet for me, I just love gravitating towards.
Yeah, we're going to come
And
back to
dance.
that. What's that?
And I love to dance because that's just flowy movement of your hands
Okay.
again.
Well, we're using video here, so you may be asked to dance a little bit. So we'll see. Fair enough there. We'll come back to the arts though, because we're going to talk a lot about the mindfulness side of medicine as well, and so how you integrate that into a practice. But first, let's learn more about Beverly Hills Dental Arts. Talk about the practice, size and scope, anything else you might want to share about what you're establishing there in that practice?
So I kind of just I wanted to change the stereotype of dentistry because I feel like it has this image that it's a place to fear. And we have all these weird tools coming at you, and you're just at the mercy of the doctor, and it's just not a relaxed, soothing position to be in. So I wanted to change that dynamic, and I wanted to make it fun and cool at the same time too, and incorporate an artistic aspect into the place. So I consider this place like a spiritual center vibe plus an art studio for me. And I have a lot of artwork up all over the office. It's got a very relaxed, soothing vibe. I try to create that energy myself as well as within my staff. So it's just this like peaceful haven where people can come to, and yeah, they're getting their smiles done, but they're actually getting a break out of their day where they can actually relax. Like my last patient, he usually is just stressed all day at his job or just working on all these deals, and he fell asleep at his appointment, which he
Yeah.
never does. So a lot of my patients that come in terrified or just having been so traumatized in the past, they come here and they literally fall asleep on the first or
Hmm.
second visit. It's kind of hilarious. I don't have to do anything really to medicate them. It's just that we've created this energy that they kind of fall into, and they just naturally relax, and we have fun with them too. So it's just kind of a different dynamic. I don't think dentistry needs to be that way. The goal is really for anyone who walks into our office to make sure that they get uplifted and actually walk out smiling more, because my goal obviously is to make everybody smile. So I want to make sure that they feel really good while they're here so that they share their smile everywhere that they go.
Yeah, that is so interesting that you brought up the sleeping because I was going to bring that up later, but since you opened the door to that, so I was one of those people that just had a real fear. Like I could feel my entire body tightening up. I could feel the tension, the anxiety in a dental chair. And through meditation, I would just do breathing exercises, and I have fallen asleep several times to the point where they get, you would probably know the name of it, but some kind of,
A
you
mouth
know,
prop.
mouth prop and just
Yes.
prop him up. And I'm just sitting there just snoozing because I have just gone into a really nice place. In your practice, what is going on there? What's the vibe? What's the atmosphere so that people are falling asleep in the chair?
I just think that it's our energy, like I said. So I encourage my staff to look at every patient through loving eyes and with no judgment, and to just openly communicate with all of our patients to make sure that we meet all of their desires and needs. And so I just think it's the open communication and just being very understanding with the patient so that it dispels all their doubts and fears just through talking to them, and they just naturally they've gotten it all out of their system. They've transformed the way that their perception of whatever we're doing because we've changed that, and then they actually have the ability to relax. Plus we have massage chairs, we have noise canceling headphones, so if they don't want to listen to the sound of the equipment or anything like that, then yes, they can listen to meditation music or something relaxing and just kind of enter their own world and let us work on them at the same time.
Okay. Okay. So I don't know if you've studied the psychology of what's going on with patients, why there is such a fear of going to a dentist office versus primary care or another aspect of medicine. Have you looked into that? Is it the personal nature that you're there and someone's digging, digging might not be the right verb to use, but they are exploring the mouth area? And is that what it is, that it feels invasive? Or why are people so scared about the dentist versus other specialties?
It seems like the ones that are the most fearful have had a traumatic experience
Okay.
somehow. So a lot of times it's they were a kid and the dentist pulled their tooth with no numbing and it was not easy, or I mean, just different painful experiences, or they were just being in these vulnerable positions where they felt like they didn't have any control. And maybe they just didn't trust the dentist. Maybe they didn't have that comfortable communication and rapport with the dentist. And so maybe it was just that specific incident or experience that triggered something that stuck with them for forever. So it's kind of just trying to rewire that experience and just have them somehow delete that and reprogram it to something else so that they can just move forward and move past it.
Yeah. So when we first connected, I really saw that you're doing some really interesting things that are focused on patient centered care. You've talked about some of them already, but kind of share with us some of your strategy. Our listeners are medical practice leaders on all kinds of different levels. Some are on the clinician side, some on the administrative side, but all of them are trying to find that way to get through to patients, to really show that they care about them, that they're engaged with them. So, what is working at your practice?
I think we just really build a strong bond with our patients where they feel comfortable opening up to us and telling us whatever they feel like sharing with us. So it's just, it's such a friendly atmosphere that it's like we're hanging out at the same time as working with our patients. So it's just a very relaxed rapport between all of us with my staff and with our patients. And I think, I mean, having a trustworthy relationship between the doctor and patient is definitely an intuitive thing that the patient senses. And we're extremely honest, ethical here. There's nothing that anyone after ever has to second guess us for. But I also think that the evolution of technology has actually helped improve the ability for a patient to trust a doctor, because back in the day we used to use film for x-rays, which, that were tiny films
Right.
that you would put in solution and we could read them, but it was virtually impossible for a patient to read them and know that there was a cavity somewhere. So now x-rays are digital, which is so much better because the radiation is minimal compared to previous um, types of x-rays, and we can blow them up on the computer screen. So I can actually show a patient exactly where their cavity is. So they're more likely to believe me because I've taught them how to read an x-ray and it's blown up huge on a screen. It's hard to question. We also have AI technology that will act as a second set of eyes and will also show the patient with the AI technology that this is a cavity, this is pathology, this is calculus under your gums, this is your bone loss. So all of these things, it's so much easier for a patient to see for themselves, which obviously helps build the trust factor. And then we use a lot of 3D scanning and imaging. So again, I can scan a patient's mouth, blow it up on a screen, rotate the model so they can see every nook and cranny of every tooth and understand what's really happening for themselves. So they know what needs to be prioritized and what needs to be addressed because they can see everything for themselves.
Okay. In reading about you, I've learned that you're a big advocate of mindfulness in healthcare. So, first, let's talk about your own mindfulness journey. So, what does mindfulness mean to you? And then, how do you translate that and bring it to the practice and to the patients as well?
So for me personally, obviously running a practice, we all live in a crazy world and we need to know how to manage our emotions and to just be on point, our most effective selves, so that we can serve as ideal mentors and role models for the other employees and really be able to serve our patients top tier to the best of our abilities. So for me, I need to I manage my own stress levels, anything that throws me off. I do that really through just breathing practices and meditation myself and just mind control. So if I personally notice that my mind is going on a track that is not
Yeah.
in the right direction, that's going to assist with anything and is just a pointless track, then I catch myself and I reset myself. And so for me, that's so important because I'm the one that is working so intimately with my patients. My hands are on them. I want to make sure that my energy is as clear and clean as possible and as positive, loving, healing, all of that, just so I have like a divine energy flowing through me. And that requires me to be in the most relaxed state possible. So whatever energy I'm transmitting to my patients actually can uplift them and soothe them. So I have to be on point with all of that to be the most effective every day for my patients because I'm really just a channel to serve and it has nothing to do with me. I just want to be there for my patients and do whatever's best for them. So I need to be aligned with following that purpose so that it benefits everybody that I work on.
Right. Um, so I got a few more questions for you. So you talked about this earlier that the atmosphere, the relationships that you and your team have with the patient sets them at ease. Can you walk us through that? Is there anything like not a case study, but maybe an example of sharing space with a patient so they are at ease, so they know that they trust you, that they know that you're doing to the best of your ability to help solve whatever dental issues they may have to help them, and walk us through that. What might that look like?
I think it's just being really friendly, like we said, when they first come in, knowing that they can feel at home. This is literally their other home just for when they're getting their smile improved. So, I mean, we're seeing our patients every few months
Mm-hmm.
because we have to keep this bacterial load in their mouths under control. Because, as you know, the bacteria in your mouth, if it travels through your body, it can cause other systemic issues, like cardiovascular issues, Alzheimer's, arthritis, all these diabetes, all these things that it's been linked to. So we try to clarify the importance of being here. So we have to build a friendly home-like environment for them to want to come back regularly because that's going to benefit their long-term health. So so yeah, it's basically just communicating freely with them and just also training them to a certain degree to manage their own stress with whatever techniques they're comfortable using because I found that I think a lot of other dentists have they generally use a lot of nitrous oxide. They prescribe a lot of Ativan, Xanax, all these medications to help calm down their patients. But I once in a blue moon need to do that.
Mm-hmm.
They'll come in thinking that they need some pharmaceutical drug or they need
Right.
nitrous and they need all these things and they ask for them and then I kind of talk them out of it slightly and they see that, oh, I actually don't need any of this because I've overcome it through my mind in a way.
Right.
So I mean most of those things they're just toxic for your body. So I'm not a huge proponent of unnecessary pharmaceutical drugs. I mean
Right.
I generally want to work with natural products overall.
Mm-hmm.
So I lean more towards that. But yeah, I mean, I think we've used nitrous maybe once this year and
Okay.
Xanax and Ativan again like twice. So it's extremely rare that I use it, and our patients are fine. I also know how to numb them in a way that it's painless. And so I think once they're numb and they didn't feel the injection, what is there to be scared of? Now you're not feeling anything.
Right.
So there's really nothing that is to worry about. You're
Mm-hmm.
already numb and everything's comfortable.
Yeah. About almost 2 years ago, I had a tooth extracted and then replaced, and they gave me a lot of options. It was that a surgeon did this. One of the options was just to stay fully awake and just get numb, as opposed to be knocked out, so to speak. And I chose that option because I wanted to directly experience it. I wanted to see like what it was. And I don't know how I would do it if I have it again, but the surgeon was literally had his knee in my chest and there were things flying, and it was chips of tooth that I would later find like on my shirt in my pocket, and it was like a battlefield or something. But I was there for it. I was really in that moment, and I'm not a masochist by any means. I certainly don't like pain. And it's not so much, I was numbed thoroughly, but it's just that fear like, oh my gosh, this is like intense. There is so much going on here. But I just wanted to share that with you because I was grateful that I got to be fully awake for it and just be there in that moment. I don't know. Any thoughts?
I mean,
Anything?
when I was in dental school, I loved doing extractions because it was such a challenge and such an accomplishment.
Yeah.
But I grew out of that pretty quickly. And I kind of just got over doing extractions.
Yeah.
And I'm doing more of the fine art, not so much of the
Right.
surgical procedures.
Right.
So it's just a different procedure. So
Yeah.
I'm not needing such intense anesthesia as you would
Right.
in an extraction. I'm not using there's no pressure involved with
Right.
trying to do a tooth extraction. So yeah, I'm not really doing root canals or extractions anymore.
Okay.
I'm pretty much doing mostly cosmetic and general dentistry.
Gotcha. Okay. Another question here. Found out that you had a unique experience of serving on a panel with Deepak Chopra. He's a pioneer in mindfulness and holistic health. Years ago, I had an opportunity as a journalist to go spend some time at the Chopra Center in La Jolla, and that was a pretty awesome experience. I really enjoyed that time. But tell me about what it was like to be on the panel with Deepak, and maybe what you learned about it or what you took away from a mindfulness perspective that you can now share with others and share with your patients as well.
Yeah, I mean, it was definitely a very special, unique experience being around all these like-minded individuals that all were focused on mindfulness and long-term health, and they were all just top leading experts in their field. So it was really interesting hearing different perspectives of different um, genres in medicine and otherwise. And Deepak, he's just his mind is so intriguing, and he would just either be on a panel or not be on a panel but still put his 2 cents in and would know something about everything
Hmm.
and just say something profound that just leaves you captivated and speechless. So it was just fun listening to him on every single subject. And what was cool about right before I went on to my panel was he was talking about how important smiling is because you really want every cell in your body from head to toe to be smiling. Be I mean, he was saying it more as like analogy, but it literally was what I was talking about after, just how smiling is so linked to
Hmm.
mindfulness because it actually releases neurotransmitters that boost your immune system, relax your nervous system, all of these things that really promote long-term health. And so it was just nice having him lead into that because it's true, the functioning of all of your cells in your body is going to do much better and perform much better if your mind is relaxed and in a happy state because your mind and your body are in constant
Hmm.
communication, so it's going to direct the performance of your body cells. So, and smiling only enhances that because you're triggering to your brain to release those happy neurotransmitters, which ends up going through the rest of your body and uplifting all of the cells in your body.
Yeah, I mean, we've all experienced that. I mean, just putting a smile on your face. You might be like at a conference or somewhere, and a speaker might say something like, just bear with me, everybody. Just smile for a minute. You may not feel it at all, but just put a smile on your face and look around at the other people smiling, and you really can feel that and feed off of that energy. And it's just such a different experience than the opposite of that. If
Yeah,
people
for
are,
sure.
yeah,
No,
so,
it's so contagious and it just becomes this infectious loop between
hmm,
each other. As you smile at one, and that it's like
right,
almost a domino effect. So you're really uplifting whoever you smile at because if they're walking around caught up in their head or in a down mood, when you smile at them, it literally they automatically smile back and it just snaps them out of it in 1 second. And it completely can shift their day. So it's so powerful and it's just so healthy for you, but it's so healthy for whoever you smile to as well, because now you've kind of cured them in a way. So it's just the way to be.
yeah. Well, I think that's a wonderful way to end this particular episode. So, Dr. Rajpal, I want to thank you so much for joining us on the Mindful Medicine podcast.
I so appreciate it. It's been great chatting with you.
All right. Well, everybody, that is going to do it for this episode. I'm going to put some direct links into mindfulness and healthcare and that connection in the episode show notes. So until then, thank you all for being podcast listeners.